How about advice for students in their third and fourth years of med school? So the clerkship years.
Yeah, so orthopedics, the good news is it seems to be a good match between the number of of interest in applicants and the number of spots these days. So if you are interested in orthopedics, I think that there's a good chance that as long as you're someone who has demonstrated a little bit of an interest and spent a little bit of time, you'll get a good chance of matching to a good program. There's really no substitute other than being there in person. So if you're someone who's competitive or wants to be competitive for orthopedics, then I would encourage you to try set up electives at different programs. And when you think about which program you might want to go to, yes, the university is a big part of it, but I think the location, if you're someone who loves skiing, then yeah, rank Calgary or Vancouver #1. They're good programs, so you get a chance to ski all year long or a large portion of the year. If you're someone who says, my entire family's in Toronto, and for me, Toronto's an important place to be, that's also a valid reason. If you're a foodie and you love Montreal, then yeah, apply to McGill. That's great. So I think that you should try and explore different cities and different rotations. Most of the time, we're looking for 3 reference letters from orthopedic surgeons. Ideally, if it's people we know that are better known, that helps your application in terms of PGY3, or CC3, CC4. Research is nice to have, but not a must. So if you get a chance to participate in a podium presentation or you were a 3rd or 4th author in a paper, those things are nice, they're good, but they're not the end all be all. Plenty of people get into orthopedics that had 0 research experience. I didn't have any research experience whatsoever when I matched to UofT. So I don't want people to kind of lose sleep over that. And the other thing I tell people is that you also want to make sure that you have a good interaction and you fit well with the residents, because they have a big voice into who we train and who we decide to pick for the next batch of junior residents. So if the residents are, have a favorable opinion of you, that think that you work hard and you're a good person, then that counts for a lot in terms of applying for a program.